I think my audio is good. Audio is good. Let's go to the next one. The next one is 7. Scenario. Patient diagnosed with multifocal invasive ductal nodular carcinomas of the left breast. But okay, so yeah. Oh wait. Oh, oh wait, hold on. Left breast needle core biopsy on 3/6 and 3/15. So two different guys here. 3/6 left breast at 4 o'clock. Biopsy proved invasive carcinoma. 3/15 at 2 o'clock. Left breast. Okay, so there are two tumors here, different places of the left breast. Left breast. Okay, let's see. Let's continue reading. Surgical resection of both tumors were performed. Patient underwent partial mastectomies of both 2 o'clock patients. 2 and 4. Axillary sentinel. That's going to be code 2 on 423 preoperative report. Okay, so partial mastectomy. I'm going to code 200. Okay, just leaving it there. Oh, sentinel. Sentinel, I'm going to code 2. Sentinel biopsy here. Path report proves 0 out of 4 sentinel nodes are positive, and the 2 lesions were separately excised. Diagnosis of the 2 tumors. Okay. Um, Margins were clear, but this margin was positive. Patient underwent re-excision for margins. That was negative. Okay. Oh, here we go. So this is re-excision for margins. There's a code for that, which is this one, 240. Re-excision of margins from primary site for gross or microscopic. So yeah, re-excision, we would do that one. So first, I had I'd done this before. I remember, or maybe this was a different scenario, but if you have a partial mastectomy, there's a code here, 200 when you do a partial mastectomy. Um, yeah, I mean it's right there. Partial mastectomy. And I would leave it as that if that was it. But because the patient underwent a re-excision on a different date in this abstract here, I'm just calling this an abstract, but um, in this scenario, you have to remember that there is a code for that. Otherwise, you get it wrong, or yeah, you don't get 0 or 100 out of 100, and it hurts a little. But anyway, yes. So when there's a re-excision for margins, B240. Make a note of that. I think I did. I don't have my notes with me. But yes, you're gonna do that one. Okay. It was negative. So both margins are clear. We can put here in the surgical field margin or surgical margins field 0. There's no residual tumor. If we didn't do a re-excision, um, and there was a positive margin, then you would go and put residual tumor. But again, in this scenario, there was a re-excision for margins and it was clear. No residual tumor, code 0. Um, and then they had radiation at the left breast and no further surgery. So reconstruction, A000. This one, usually 0, because I think it has to do with if the patient has passed away. For now, and there you have it. I think because I fixed my audio, I'm gonna keep going. So let's do the next one. So scenario 8. Um, Continuing here. All right, take note of the diagnosed breast. It looks like it's the right breast in the upper outer quadrant. Needle cord biopsy on 422. Sorry, I have my hand over my mouth. Um, I don't know what this means, but I do know what this means, and it means that the right breast is the one with the cancer. Physical exam only prescribed a palpable lump in the upper outer quadrant of the right breast. Axilla was normal. Uh, okay, proceeded directly to surgery. Let's see what surgery was. Bilateral skin and nipple sparing mastectomy with right sentinel lymph node biopsy. Immediate first stage bilateral breast reconstruction. Okay, lots of stuff here. So, bilateral skin and nipple sparing mastectomy. Let's go over there. So, um, skin mastectomy, skin and nipple sparing. Isn't there one where it's skin and nipple? Okay, no, not these. What's the skin one? Skin acidity involves all breast tissue, nipple areolar complex. S- I'm gonna go with nipple sparing. Let's see, actually. But preserves the nipple areolar complex and breast skin. Breast skin. It is performed with and without sentinel. Okay, I'm gonna go with B400, and it was a bilateral, so it was both. The diagnosis, it's right, but they did both, so it's with removal. This one, and then there was something about reconstruction with tissue expanders. This one, tissue expanded placement. Something about margins and no. Path report. Sort of the DCIS. So here we go. 0 out of 3 sentinels are positive. So that's oh, 2. The resection path report goes to description. Attached margins were negative. I'm going to do 0. The left breast was negative for malignancy. Underwent home therapy. Second stage reconstruction. Exchange of tissue expanders. Subsequently performed at an outside facility. Okay, so this because it was at an outside facility, it wasn't done in our hospital. So to say, we're going to keep it at the tissue expanders. This one at breast reconstruction. And this one is 0 for now. Cool. Let's just do the next one. Breast 9. See, patient diagnosed on the right, so right breast on 615. Patient who has a history of has a distant history of left breast cancer and self-palpitated a new right breast mass. Patient was found to have a new calcified lesion in the upper inner quadrant of the right breast on imaging. Physical exam proved a palpable approximately 2 centimeters. Okay. Patient wished to proceed with excision due to history of cancer and anxiety over new lesion. So what was the surgery? Right breast excisional biopsy. Incidentally proved DCIS. That path report proved. Okay. I'm kind of going through everything because if you skim, then you miss stuff and then you get something wrong. But so far, it looks like it's notes on the biopsy. margins were negative. Here we go. So you could put margins are negative. That's 0. And um, excisional biopsy. Now, this is the type of surgery it was. And it looks like there's this right here, excisional biopsy. Oh, let me read more though, because we don't want to get something wrong, right? And if we did, then it's okay because this is practice and you could do it again. So down there, the mastectomies. Um, yeah, okay. So I'm gonna go for this one because this is the same thing, but it's not for atypia. This one is for diagnosis excision or diagnostic, whoops, diagnostic excision or no preoperative biopsy. This is what happened. They excised it because they felt something. Okay, so yeah, I'm gonna stick with this one. I think it's this one. I'm sure it's this one. And then there weren't any lymph nodes. This is 0. That's 0. And then no surgery. I believe. Wait. Yeah, I don't think. No additional surgery. Let's see. Oh, yeah. There you go. Okay. So the thing that I was kind of like iffy on was the type of surgery, but it ended up being this one. Yeah, because it's not atypia. There wasn't anything about atypia here. There's no breast reconstruction, no oh yeah, margins are negative here. Okay. Boom.